On behalf of Beyond Blue, we really appreciate the opportunity to be here, and I guess for to Rob, Rebecca, to Ashley, to Matt, to all the volunteers, it's just phenomenal to be able to actually speak to mental health and workplace mental health to an audience of close on 400, 500 people. So thank you to the DDD team for putting it on your agenda. We really appreciate it, and I really appreciate it being reached out. In the context of the next half an hour, 40 minutes, and I promise I won't keep you away from the sort of end of and celebrations that will follow, but I do want to discuss at a very personal level, I guess, mental health, but also really give you some practical tips and tools to take away to your workplaces to help you take action at an individual level, but also an organisational level. But some background before we get there. Who here has heard of Beyond Blue? It's phenomenal. And just to, I guess, give some context to that, Beyond Blue was formed by the Honourable Jeff Kennedy in 2000. It was really, and always has been, about raising an understanding and awareness of depression and anxiety and combating the stigma associated with that discussion. And I think as a society, and particularly within Australia, there is a greater awareness, but there's still a lot to do in this space. But it was also about guiding people to help. Our vision is to help all Australians achieve their best possible mental health, and so we do provide some phenomenal services. Our 24/7 support line, the Beyond Blue forums, and a whole range of other services that are there to help people manage their mental health and manage it when they're doing it rough. I'd also like to point out that part of that has, remit has expanded over the course of the last 5 years, where we're looking at suicide prevention and suicide awareness, and the reasons for that will become pretty stark shortly. But also providing even more tools, and that's where the Heads Up initiative comes into play. Heads Up are free tools and resources for organisations to take action on workplace mental health. I'm standing here as an employee of Beyond Blue, but actually Heads Up is supported by a whole range of wonderful organisations, federal and state government bodies, industry bodies, business groups, and also a range of supporters from the mental health sector, great organisations like the Black Dog Institute and SANE. And so it's kind of with pleasure that towards the end of this you'll get some resources that I think are really valuable and evidence-based. And one other thing, if I might say, and Michelle mentioned it, I stand here today speaking to you not as someone that has, is a clinician or a doctor or a psychologist or a counsellor. In fact, my role before joining Beyond Blue was with the technology company Retify. Not as a software developer, I was in their marketing team. And I think that the reason that I'm here today is in part because Retify gave me the confidence to talk about my experience some 8 or 9 years earlier when I was diagnosed with clinical depression. Retify was kind of challenging because I entered an organisation where there was an open dialogue. Everyone felt and could have a discussion about just about anything in that business. And it was direct discussions and they were open discussions. And that was challenging for me. I come from some pretty conservative environments, but it was kind of cool too. And it was that environment that actually enabled me, I guess, to kind of go, well, hang on, I've got this experience and I'm not talking about it. Could I perhaps talk about mental health in the workplace more than I do? Because I was watching this sort of vibrant discussion occur in a company and an industry that I hadn't been part of. So I approached the board and the executive and said, do you mind if I enter this space? And I volunteered for Beyond Blue. You'll hear a little bit about that personal story today. It's not that staggering, to be honest. It's actually about life. But the net result is I'm speaking to you as a peer, not as a clinician or a doctor. And we'll see the importance that those trained professionals have as well as we move through. So we're going to talk about 4 topics. Understanding mental health at very much a layperson's view. Certainly why workplace mental health is important and giving it some context around workplaces, and I'll touch on the nuances of the software industry, but generally workplaces. How do we go about creating mentally healthy workplaces, and again finishing with some tools and tips that I hope you can take back and help either yourselves or your colleagues. So why are we here, and let's talk about mental health. I think the important aspect of talking about mental health is that often when we think about mental health, we think about mental ill health. We think about illness. And that's really important because we need to understand that. But actually, if we think about the World Health Organization definition for mental health, it's about a contributing life in all aspects of life, wherever we are, family, work, the settings that we live our life in. And it's also about being in a position where we can manage the normal stresses and strains of life. And that's mental health. I actually find it easier, rather than going on a definition like that, to think about it in the point of a colour continuum, if you like. And here we have, green on the left-hand side that is really around us and individuals when they're thriving and they're contributing and they're living a life that is full and we are healthy. But we also need to understand that mental health is not a static state. It runs that range, through amber and orange and into red, where we have clinical conditions, and where indeed I ended up with clinical depression about 8 years ago in a professional services firm. And I want to dig into that a little bit because it's really important that, yes, we support people with a mental health condition, but we don't actually treat that as the other, that it's actually for all of us. Mental health is about all of us. It's about life. And it's about keeping the healthy healthy. And if we, as individuals or in our colleagues and our peers and our friends, see people with changes in behaviour, and I'll start to talk about some of the signs and symptoms, then we kind of need to know how to take action either ourselves or to help others, to help them move back into the green. It's not always going to work. There's some things that we can try our best, but it's important to really understand that when we talk about mental health, we're talking about that continuum. We're talking about everyone in this room. And that rather than think about it as illness and supporting people with illness, which is critical, think about it as affecting us all, because it is about being in the green, the amber and the red. If I talk a little bit about my experience, I guess, again, there's no amazing story here. Essentially what it is that I was in various roles in a commercial environment and ended up where I guess I couldn't operate. My life was impacted. For me, I'm an anxious person, and here's some of the signs and symptoms of anxiety. Now, please don't think that, if you've got a sign or a symptom that all of a sudden you've got some clinical condition. No. It's more about understanding and recognising these signs and symptoms in ourselves and others. And I would argue that for many times throughout my life, I didn't really get this. And if I did, I certainly didn't think I needed help around it. But I, at heart, am a pretty anxious person. I can tell you I didn't sleep a lot last night. I do a number of presentations, but I still get really nervous about them. I still think, hang on, there's a whole heap of people here that want to learn and have an appetite to learn, and what the hell am I going to say? I overthink it. There's feelings of dread all the time, but now I know how to better manage that. But I guess more importantly, as we look at those signs and symptoms of anxiety, it was depression that I got to, and understanding the signs and symptoms of depression. And for me, thinking back all that time ago, I got to a stage where I probably hadn't slept for 3 or 4 months. I'd go to bed at, say, 10 o'clock. I'd fall asleep on the couch probably for an hour and a bit after sort of just being drained from work. I'd go to bed 11, wake up at midnight. My beautiful wife is next to me, and I would just toss and turn all night. So I was lacking sleep. I was really doubting my ability to add value anywhere. I didn't think I was the greatest dad. I didn't think I was the greatest manager. I didn't think I really had any sort of value. And I really think I need to point out here that I'm pretty fortunate. Right? I've got a beautiful wife of 23 years. I've got 2 beautiful daughters. My family has never been beset by tragedy. Touch some wood somewhere. I've had and have great social networks, and I mean that in terms of friends and family. Strangely, I'm not on Twitter and I'm not on Facebook. I am on LinkedIn, but social networks in the point of view of actually, having some really great relationships. So there is no actual logical reason why someone like me would fall into clinical depression. But I did. Because looking back, I don't really think I understood the signs and symptoms, or at least I didn't take them seriously, or I thought that I didn't need to talk about it. I could work it out myself. And I couldn't. And here's where it becomes really important. I think about it logically as a business person, right? And I go, well, if we don't know something about software, we bring in a software consultant or we bring in the specialists and we actually go, you know what, help us here, I don't know what I'm doing. If we break our leg, we definitely go to the doctor, we know what to do. If we're doing a merger, an acquisition or something, we get the professionals in. Yet, if we're doing it tough mentally, we think somehow we've figured it out ourselves. And I believe that we actually need to have the conversation, firmly believe we need to have the conversation around mental health, both in terms of individuals and looking after our own mental health, but also in looking after and supporting others. And why do I say this? Because the conversation is essentially what eventually helped me. Even though I kept the mask on for God knows how many years, eventually it broke and I broke. Eventually, I'd be managing teams in organisations, and what would happen is I'd go to the toilet and cry while I'm making decisions for the company that were, generally probably pretty good still. Probably I was affected, but I'd be a mess. People are coming to me as a leader, and I'm kind of going, yep, I can do this. And I think I would offer pretty wise counsel, I think. But they wouldn't see me go into the toilet and just basically break down or go home and be a mess and not be able to contribute then to my home life and everything else that was going on. And eventually it was Sarah, my wife, that said, Mark, I can't help. You need to go and get help. And somehow, and she'd said that a lot, right? Somehow eventually I went to the doctor. So having the conversation with my wife at the smallest part, I certainly wasn't having in the workplace at that time, I'll give you the scoop. And I wasn't telling my friends. But it enabled me to actually realise that, hang on, I probably should, even if it's to humour Sarah. And I went to the doctor. And I think that here's the next part. Yes, we need to increase our understanding, and we need to understand that actually mental health is about life, and that we go up and down through that continuum that I was talking about. We need to better understand those signs and symptoms and then feel more confident to have the conversations. But actually, it's not coming to people like me with a personal experience, albeit that's good. It's actually reaching out to the professionals, the doctors, the resources at Beyond Blue, at Lifeline, counsellors, psychologists. For me, I went to the doctor, and I remember it clearly, Dr. Avigan, and again, it seems pretty simple, but it was hard because I'm thinking, I'm okay, but I'm not. And the doctor said, why are you here? And I said, because Sarah said I should come. And he went, okay, well, why else are you here? And I said, well, she thinks I've got, something going on upstairs. And he goes, well, what's on your mind? And I don't know why, safe environment, I just broke down. And I just spoke to him for about an hour and 10 minutes through a complete and utter sort of mess of tears as I tried to figure out what it was I was there to talk about, because I had kept it all bottled up. I should mention as well that, I guess in that deepest time for me, I was fortunate because I never really considered taking my own life. I was more considering walking away from the good life I had. I was more considering leaving my family, leaving my wife, leaving my kids, or leaving the social environments that I was in. And I have left many jobs historically because I hadn't actually thought about and understood the way mental health was impacting me. So I'd kind of run away from the problem. But that was brilliant because somehow the doctor got through to me and said, Mark, you're sick. You're ill. And when a doctor says you're ill, something broke through, all that irrational thoughts. And I went, okay, that's fine, I get that. And that was the start. I was then able to go and see a psychologist, and I was able to talk things through. I somehow felt more comfortable talking to my wife more about it now that I was talking to a psychologist. And I guess the sort of, and take this the right way, but the rational part of me was kind of coming through. And I could see that actually I had a pretty good life. But I still made a whole range of changes, small things, over the course of sort of 6 months that got me back into the amber and then eventually got me back into green. The small things like, I started to do a bit more physical exercise, started to run, I started to go to the gym, I started to eat better, and what was happening with the physical exercise for me, and everyone's different, by the way. I'm not saying go and do physical exercise and fix mental health, no. But I am saying, for me, that meant I was tired and I was physically tired. So actually what would happen, I'd hit the pillow and I'd go to sleep and I'd sleep. Wow, when you sleep, how good is that? All of a sudden you wake up and you've got a clearer mind and you're actually going to have a greater propensity to talk, And so over the course of time, by getting support, by seeking support, I was able to move back into the amber and back into the green. And pleasingly, I still know my own triggers, and that I believe I manage my mental health quite well now. But when, I see and get some of these signs and symptoms that I talk about, I know that I need to act. And that act might be to talk to someone. It might be go back to a psychologist. It might be actually to, go to the gym and just break it, or go for a ride, or do whatever it might be. But rather than circle into a mire of my own negative thoughts, try and break that. So in telling that, normally, to be quite honest, apart from when I was volunteering, I haven't sort of spoken about that for a little while, but Rob sort of asked, and sure, Rob Moore. All I'm trying to say there is that really there's nothing special about that story, right? I mean, this is just life. It's someone that is, has a pretty good life, and poor me, I was managing depression. But the net result is that I was able to get myself back into a really strong part, strong enough that when I was at Ratify, I wanted to actually speak about it in the workplace to leaders, because we need to do more. And so that's a sort of baseline understanding of mental health. Why is workplace mental health important? Well, again, I know we've got celebrations coming up, but I just kind of want to say that it's important because what we have here is a societal issue. In Australia, nearly 8 people take their own lives every day. It's about 2.5 times a road toll. For every 8 people that take their own lives, about 30 people attempt. We also know that at any given time, around 3 million people will be managing depression and/or anxiety. Now, there's no, some people will take their own lives without exhibiting any signs and symptoms of depression and anxiety or a clinical condition, but we know there's a risk factor there. And so that discussion that we've been having for a long time around depression and anxiety becomes important, right? We have a societal issue. Businesses and organisations operate within society. So you know what? We're part of the solution. We can help. We'll often think that, workplaces are the stressor, and they can be. Workplaces are the places that give us the anxiety and the depression. And sometimes they can be, and we need to work at that, and I'll talk about that. But sometimes they're a great support, doing quality work. Being with great peers, being with quality people that really know their stuff and that you're contributing and you know your role, and the design of the work that you're doing is powerfully good. Workplaces can be good as well. But this is a societal issue, so now let's bring it into the workplace. I should note that a lot of the facts and figures here are on reports from PwC, Instinct and Reason, TNS Social Research, but all this is on the Beyond Blue website, and all the statistics are there for those that want to go into the source material. But let's bring it into a workplace environment. With the prevalence that we've got in society, we know that at any given time, 1 in 5 employees may be being affected by poor mental health. We also know there's a substantive cost to business of around about $11 billion in Australia. Most of that's around absenteeism and presenteeism, not so much compensation claims where you might think it is. But where my mind goes, again, from my various management roles and all the rest of it, is into a couple of figures. Yes, there's a return on investment, an average return on investment of $2.30 for every dollar invested in effective mental health and wellbeing programs, interventions, if you like. And that's important. But what really stands out for me is the employee engagement and becoming an employer of choice and actually attracting people to your organisation because you're doing good stuff. You've got a reputation for managing the health and safety of your employees from a mental health perspective. I don't know an executive team that doesn't desire to have greater engagement with their team, to drive greater productivity and to drive greater commitment and in the end affect the bottom line. Now, sometimes when we talk about a slide like this, people go, why aren't you making it about money? It's about saving lives, right? And it is. But we also know that businesses and workplaces generally run by a bottom line. So whether or not you're actually doing it because, as Carolina mentioned this morning, it's ethically right. It's the right thing to do to look after our people. Or actually, you know what, you're a financial director and you actually need the numbers to back up the investment. Or actually, you're in HR or in the executive teams and you want greater engagement. I don't really care what drives the action, but take action because there's a business case around it to take action. So if we've got that understanding of mental health, that it's about all of us, then we've got this societal issue and we know that it's a business issue. We also know that we're kind of not there yet. Through various studies, we know that most employees view a physically safe workplace as important. And most employees kind of think that their workplaces are physically safe. I'm not saying they are, but mostly, there's an alignment there. Even more employees value a mentally safe workplace, but only half the employees surveyed viewed their workplaces as mentally safe. So we can see the disconnect there between physical and mental health. And the kind of leap that we've got to make to kind of go, hey, probably, I was born in 68, so I'm 50. I'm 50. I made it. But the net result is, back in probably the late 60s, early 70s, physical health and safety was just getting off the ground in terms of systems and processes and governance. So really what we're doing here is making that leap to go, okay, hopefully in how many ever years, 2, 5, 10, you don't need a Mark Leopold or a Beyond Blue or anyone else up here talking about workplace mental health, because it's about the way we do business, because we've actually closed that gap. But I'd also say that there's absolutely a legislative and regulatory requirement. We don't have a choice, by the way. The legislation isn't just about physical health, it's to keep our people healthy and safe, both physically and mentally. Now, I'll just say with this one that, this is critical because it is about compliance. But if you're just doing it as an organisation to tick the compliance box, I think you're missing an opportunity to have some of those richer relationships that we were talking about, some of that authentic leadership that will come through in as I talk on these next slides. But I hope in that, brief period now, you've got this sort of understanding where you go, yeah, it's a business issue. And whatever's driving you, whether it's compliance or financials or engagement, we can move forward. So how do we go about creating a mentally healthy business? Well, if it was easy, again, I wouldn't be here. But here's a few ideas that come to mind. This is actually a definition of what a mentally healthy workplace might look like from Guarding Minds in the UK. Why I like this one is that end. Having energy left over at the end of the day is kind of a nice thing, because I know that historically I've been in so many roles where actually for very long periods, if not just my entire working life, I was drained. I was gone. I wasn't actually going home energised. I was going home to recover. Now, again, please understand that given that I come from a business background, I'm not saying that there's not times when we all work on projects and they go flat out, and I certainly know from a software dev perspective and a tech industry that occurs, right? So it's not about the spikes. It's just about saying, well, actually, understanding, are we actually creating environments that are energising our people? And I kind of like the idea behind that, even if it's a little bit sort of, of a broad framework. More specifically, we know some attributes of a mentally healthy workplace from those that are doing it well. And it is about fostering that positive culture, playing to people's strengths, managing the risks associated with the work that we're doing. Now, clearly, I don't know, a FIFO mining environment is going to have very different risks to a professional services firm, is going to have different risks to software development. In FIFO, it might be around, the disconnection from friends and family and being away for a long time. In professional services environments, it might be around, continued long hours, perfectionism, all sorts of different things that start to sort of sit there and go, well, in software development, it could be anything. And given the breadth of organisations around and what I've seen, it could be you being isolated and working alone. as you tap away in trying to drive some of that development. It could be that you're embedded in teams that are in a toxic environment. It could be that your workplace is a toxic environment. It could be you're embedded in teams that are in a great environment. But it's about understanding the risks and helping to mitigate that, and I'll talk a little bit more about that. Clearly, it's about supporting people with a mental health condition, and I'll talk a little bit about that as well. And then taking a zero-tolerance approach to discrimination. Again, Carolina talked about this whole idea around inclusive workplaces and inclusive web, and the fact that DDD have this sort of central pillar of diversity and inclusion. How cool is that, right? Diversity of thought. People with a mental health condition and anywhere on that continuum have great stuff to offer. And we also know that discrimination has direct links to anxiety, depression, and worse. So zero tolerance to bullying and discrimination. And some of the critical success factors that we think about here, and none of this should come across as rocket science, I hope, because I think it's predominantly what we do in any good business. But what we know, again, we need leadership commitment to mental health, and I'll talk about that as the last point of this slide. But we absolutely need to encourage and have our employees participate in this conversation. Think about the prevalence stats that I've already quoted. Most of us in this room will have some understanding, either directly or indirectly, of managing or helping people manage a mental health condition somewhere on the continuum. And therefore, there's a latent kind of desire to actually help. There's 500 people in this room that are somehow interested in this topic, and therefore tap into that and also understand that it's an ongoing piece. We don't treat mental health as an other and have it as a program or have it as a policy, and we've done the policy and it's game over. It's an ongoing communication with our organisations, just like most of the things that we operate as business as usual, whether it be broader work health safety practices or whatever it might be. So those three factors are kind of important. The leadership commitment one is fundamental because it's about the time and the allocation of resources, and it's actually about permission to talk and putting in the processes and the systems and the supports in place. My only reservation sometimes with this is that if you don't have leadership commitment, it doesn't mean we do nothing. Because we have roles to play as leaders and influencers to actually drive that commitment within our organisations. So what can we do to understand, and what can people in this room do to sort of take a position of influence, both, again, we're talking at the workplace, but this bleeds outside the workplace, right? But let's understand what we can do. And it is about increasing our understanding, because as we increase our understanding, we reduce that fear of actually taking action or having a conversation or actually seeking help. So, I implore you to use the Heads Up resources at a baseline to improve your understanding of mental health. But then it's about using that authentic voice, your own voice. The presentations that we've got have speaker notes, at Beyond Blue. I just can't use them because at any given time I'm not quite sure what's going to come out. Right? I don't think I've done a similar presentation. I mean, the content's there, but it's about just saying, if you're going to talk about this, talk about it in a human way, as you would other aspects of your life, and try and approach it in that manner. I'm not saying it's easy, right? And in fact, I had a great conversation just earlier about how hard this is because of our cultural norms to almost hide this stuff away. That's why it's a long-term societal change, this. This isn't about fixing something overnight. It's about the continued conversation. But please look at those elements and think about what you can do as individuals within your workplaces to influence and lead accordingly. And of course, the basic stuff about also, recognising the accomplishments both within ourselves and our teams. We don't have time today to go into a full spectrum of how you might apply this in an organisational context. On the Heads Up website, there are great resources like this as a how-to guide on how we might apply and start to strategise and plan around workplace mental health. They're free downloads. You can get it in digital copy. There are limited hard copies to get as well. But the net result is, there's 4 steps that we can take to actually implement our strategies and our plans. And again, I hope you're looking at this going, well, there's nothing special about that. That's not real hard, because it's not. It's about actually just taking the action to put it into structured systems and processes. And if you don't have that leadership support, how do we gain it? And it's about building the business case that we touched on earlier, and influencing those executives in HR and in finance, and doing what we need to do to actually coalesce that team to go, this is important. How do we actually identify the needs? There's a whole range of tools and tips about how we actually look at what we're doing. And I would say most organisations are probably already doing some stuff in this. And I'll get to the next slide shortly around how we might do it in a more integrated manner. But it is around going, well, what are we doing? Are we doing anything? Probably are. And starting to go, okay, and where are the gaps? What aren't we doing? I want to dive into the third point there in terms of developing a plan, because the work of Tony LaMontagne and his team shows that really the greatest benefits around workplace mental health get to be taken when we take an integrated approach. And that can mean many things to many people, because an integrated approach to me also says things like, well, integrate it within your existing work health safety programs or your HR programs or whatever it might be. So, integrated in this sense is actually no. We absolutely need to support people with a mental health condition. So that is a pillar, if you like, of an integrated approach. But let's also think about promoting the positives of good mental health and the positives of good work. And let's also make sure we're putting in protective factors to ensure that we're keeping the healthy and we're understanding the risks and we're mitigating those risks associated with that. So yeah, absolutely, let's make sure we're supporting people with a mental health condition. But let's also build a holistic view about how we might actually go about getting great benefits over time. Now, I guess the danger here, and to quote an MD of my past, let's not boil the ocean. I'm overwhelming you a little bit with a whole range of information here to go, what does it mean? And there is a desire, and the larger the organisation gets, the bigger it is almost they want to do everything at once and have the magnificent long plan and strategy. But actually, you know what? That's something to evolve to. Start small and iterate. Start with little things and then move and see what you learn and then progress. I think there's some, I'm not a software developer by a mile, but I think there's some lessons to work in how we think about that sort of agile approach to how we take that into how we would, run out programs around mental health. It doesn't need to be the solution at the end. We can actually work towards it. And so finally, and wrapping up pretty quickly, I just want to let you know you're not working from a blank sheet of paper. There are phenomenal free resources at headsup.org.au for you to draw upon. It is not the only source of resources, as I say, supported by the Mentally Healthy Workplace Alliance, but they are great resources. As I already mentioned, there's a whole range of information around workplaces, but whether you're a manager, whether you're an employee, whether you're a small business, and if I can touch on that for a minute, because I imagine there's some small businesses in the room, whether you're your own business, you're a consultant or whatever the case is. And that is to say that some of this is too big, too much all at once for a small business. And so there's now new information on Heads Up around how you might approach it from a small business perspective. And really, a lot that's coming out, and Beyond Blue does a lot of work with stakeholders to try and figure out, how we can better serve our end customers, to the Australian public. But small businesses are telling us they want it through the channels they get. So they want it, if they've got a trusted advisor from a bookkeeper to an accountant, then let's use that channel. It's about how do we look after ourselves as small business owners. And I sort of equate this, not Beyond Blue term, my term, around, when you get the safety thing from an aeroplane and it says look after yourself before you look after your kids, sort of put on the mask. I think there's a bit of an analogy there with small business too, because you actually need to look after yourself, because if you fall over as a small business owner, the impacts are greater, and so are the greater if you remain mentally healthy. So just be aware that there's a whole heap of great resources that are available. I've highlighted some. I've already talked about the guide to workplace mental health. But I guess a couple of things that have come from conversations last night, and even in the audience today, which is around making sure that we as individuals, in whatever role we're playing in an organisation, we're looking after our own mental health. And there's lots of tips and tools around that, around how we might think about our own mental health. There's even things around, well, actually, should we have the conversation in a workplace? I'm not advocating that you actually can in all, because some workplaces just aren't ready for it, right? But in the context of it, if that's not the case, who are we speaking to? What are you doing to look after yourself? Who are the supports that you can go to? And if they're not friends and family as an initial part, is it calling the Beyond Blue line, the 24-hour support service, or is it going online to the Beyond Blue forums? You understand how we can look after ourselves. And importantly, how we support others. How do you have a conversation about work? If you see that Mark Leopold is, sadly in work, I think that we kind of know each other better than we know our families sometimes, because we work so closely together for such extended periods of time. So what happens if you start to see some of the signs and symptoms? And hey, Mark, it's not about saying, Mark, you look, depressed, go take a concrete pill, or let's go for a drink, or let's self-medicate, or let's do whatever. It's not about diagnosing them. It's kind of recognising that your colleague or your friend or your family member, the behaviours have changed. And hey, Mark, I've noticed you're not going out much anymore. I've noticed you're not this, or you noticed not that. Is there anything I can do? Do you want to talk about anything? What's interesting about that is that after I had my own, experience with depression, I got back and I was managing people, and some of the basic things that I did, I used to say, someone would come up to me and say, hey, Mark, I'm not feeling so good. And I'd say, hey, we're a team. You just go home, do what you need to do. Cool. Don't you worry about it. Don't worry about work. We'll work it out. I then sort of thought about my own situation, and again, everyone's different, because that is actually kind of a viable thing. There's nothing wrong with what I've said there. But then I changed, and I'm more likely to say, yeah, look, sure, is there anything you want to talk about? Try and explore, what was there. And you know what? It was interesting, and again, it's wrong to make generalisations. But blokes generally don't talk, and so they'd be, nah, it's okay, off we go. But then, the more I ask that question, the more maybe a day later, a week later, sometimes months later, hey, Mark, how you asked if there was something I want to talk about? Can we have a chat? And that small change leads to people actually opening up. And at that point, I'm no expert, right? Again, I'm not a counsellor, I'm not a psychologist, but I've got someone that has taken the effort and the trust to have a conversation with me. And what wonderful. So now it's about opening up the ears and then saying, hey, listen, have you thought about getting help? Have you seen your GP? Have you spoken to this? Have you looked at that? And guiding people to that help. So look, there's a whole heap of information there around how to support others, and I want to sort of finish as well in terms of saying that there's some great resources in online learning stuff where you can do sort of 20-minute role plays around how you would actually approach someone in the workplace, how you would have the conversation, how you would manage risks in the workplace. Now, some of these, and again, what's called SCORM compliant, so they can be dragged and dropped, for the lack of a better word, into your own learning management systems, and then you've got sort of a measurable and a way to see who's doing the training within your organisations. But others are just there on the Beyond Blue website, and they're there to use, so use them. And that's what I meant about workplaces without leadership commitment. And if that's not the case, that's cool. But you can, at least with you and your team, start the conversation on some pretty cool free resources as well. And so, to close, I guess I'd just say, look, if you can think about it in this way and align with broader workplace initiatives, fine. There is no one right way, so don't feel like you're actually going to sit there and go make a mistake. I think if you're taking action, an action that's based on some credible and evidence-based materials, you're a step ahead. It says integrate with broader work health safety systems. Do that. But sometimes you might actually have to treat it as a separate project to start with, just to get your head around it as an organisation. There is no one right way. It isn't a program. We don't do something. We don't do heads up. We don't do a thing and we push the button and mental health is fixed. No, think about it as that process and system that is ongoing, the way we do business, the way we run our businesses. And I think I'll finish in saying what I said before, that if you can, start small. Start small and grow. And that might be getting a volunteer speaker in and talking about it at a brown bag. It might be actually just letting people know that there's resources available. Wherever it is, start small and grow from there. And I think that by taking action, you as both individuals and organisations in a phenomenal industry hopefully start to, I guess, support some changes across broader society that we really need. So look, I don't know what you expected, but from the point of view of, I know that I'm sort of now keeping you away from sort of drinks and stuff, I just wanted to say, hey, thanks for putting it on the agenda. Thanks for listening for 35 or 40 minutes or however long I've chatted for. And please find out more at Heads Up. Thanks very much.